Okay, and the differences between just sort of generalized obesity and Cushing syndrome, the weight distribution in obesity tends to be more generalized, meaning you might see a little bit of adiposity in the arms and legs, whereas in Cushing syndrome, it's very centralized. Linear growth is very normal in traditional obesity, may even be a little accelerated, whereas in Cushing syndrome, it's poor. In obesity, you may have pink narrow striae, whereas in Cushing syndrome, they're wide and violaceous. And a 24-hour urine-free cortisol would be normal to slightly increased in obesity. Cushing syndrome is generally pretty increased, but this is also what causes issues, because if you send lab tests in the wrong context, you may still see a slight elevation in this urine-free cortisol. There is a loss of the normal diurnal variation. Remember how I was saying there's more cortisol in the AM, and then it falls through the course of the day. Usually a midnight cortisol should be around 0, but when you have Cushing's, both the AM cortisol and the midnight cortisol are high, which is why we sometimes get a midnight salivary cortisol. Elevated 24-hour urine-free cortisol is also seen, and there's a lack of suppression to dexamethasone. So we may do a test where we give the person 1 milligram of dexamethasone and check their cortisol and ACTH in the morning.